Okay, this is my central line dressing checkoff video, and to start, I'm going to verify my patient's order that it is time to change his central line dressing, which is anywhere from 3 to 7 days depending on your facility protocol. And we're just going to say that it's 3 days for my patient today because that's the most common that I've seen. So I'm going to do all the basic steps of knocking, entering, providing for privacy, washing my hands, and introducing myself as I'm coming into the room. So, hi Mr. Smith, my name is Maddie. I'm going to be your nurse today. Can you please tell me your name and date of birth? John Smith, 10/12/92. Okay, thank you. Mr. Smith, I'm going to go ahead and give you this mask to put on. We're going to do your central line dressing change today. I've noticed it's already been changed before, so I know you know kind of what we're going to be doing, but I'll walk you through it as we go. I'm going to help you put your mask on, and anybody in the room is going to have to put a mask on as well to create a sterile field. So I'm going to get my mask on. Mine is inside of my kit, so I'm just going to wash my hands before opening that again. I'm going to open it away from me. Sterile gloves out and get my mask out for me and put that on, making sure that it is on my nose really well. All right, there we go. Okay, so Mr. Smith, do you have any allergies to iodine or any skin allergies? No? Okay. And have you noticed any itching, burning, any pain with your central line and within the last 3 days? No? Good. So to start, all you have to do is put on your clean gloves to remove the dressing. And to remove it, you're just going to go around the edges and take them off. Take it off gently, trying not to dislodge the catheter. Lemon. And then you'll take it off in the side of the middle. And after you take your dressing off, you're going to want to look at your dressing and make sure there's no signs of infection, leakage, drainage, any blood, and you're going to want to do the same for the site. Look for any infection, leakage, foul odor, smell, redness, or irritation, and we don't see any of that, so you can go ahead and discard these gloves. Okay, and then you're going to come over here without going over your sterile field. Wash your hands again. And we're going to put our sterile gloves on. Okay. So, this should be interesting. My hands. Without breaking the sterile field, put these gloves on. You're going to come over and do the same for this side without touching the inside of the cuff. Goodness gracious. All right, so you can discard that. We're going to take our alcohol swab. Some packs, they have multiple in them, but we're lucky and we get one. So you'll have your 1 alcohol swab to clean with, and you're also going to take your chlorhexidine, crack it open, and so you're going to use your non-dominant hand and it's going to become contaminated because you need to hold this in place, and you're just going to start by holding it right over the insertion site for a few seconds. Then you're going to start with a circular motion from the most dirtiest to the least, and you're going to do that for about a 2 to 3 inch circle, and then you're going to go around creating a lot of friction all around, underneath, and you want to do this just to where it's outside of where the bandage is going to lay, and his mask would not have fallen off in real life. So after that's done, you're going to discard of that, keeping sterile filled. Take your alcohol swab, and since we only have 1, we're going to use the same one, but in other kits sometimes they have 3, so you would just use a separate swab for each motion you make. I'm going to take it down, side, and under, and I'm going to do that all the way down to where it's going to be a little bit has been cleaned from where the dressing is going to fit. So after I've done that, I'm going to drop it, discard of that, still sterile with this hand, pick my dressing up, and I'm just going to use the smallest part of my hand to take that dressing paper off. Take this, put it over with the site in the middle, press it real good. Before I would have done that, I would have ensured that the site was dry. I would not have fanned it or anything. I would have let it air dry. Okay, and so you can take your gloves off now if you want to. I'm going to go ahead and take this initial thing off. Here. You can go ahead and take all of this off. That would not have been on there. So I'm going to take my gloves off. I would initial date and time this little piece of tape, put it on the patient's dressing. Everybody can take their mask off. I would discard and clean up everything. Make sure Mr. Smith was left in a comfortable spot with his collar in reach, and I would document my findings and assessment. And I would document that that the patient tolerated the procedure well, that I did a sterile dressing change, and I would document that there was no signs of infection, swelling, irritation, drainage, a foul odor, that the incision site was healing well and looked really good, and that 3 days from the date that I did it today is when the next dressing is going to be done. Before I left the room, I would have washed my hands and made sure that the bed was in the lowest position. And yeah, that's it. And that's good.